So I did my project on adrenoleukodystrophy, also known as ALD. It was first described in the 19th century as Schindler's disease. ALD is a progressive condition that affects the adrenal glands and the growth of myelin in the brain and the spinal cord. Myelin is needed to insulate nerves in the brain and the spinal cord, and adrenal glands are needed to produce different hormones such as adrenaline or cortisol. ALD is caused because there are problems with the peroxisomes, causing them not to break down a fat called very long chain fatty acids, also known as VLCFA. Peroxisomes are tiny structures in the cells that help break down large molecules of fat into smaller parts so that the body could use them. Since the VLCFA can't be broken down, they accumulate, especially in the brain and the spinal cord, causing nerve cells to have difficulty sending signals throughout the body. As a result, individuals with ALD have problems with memory, learning, speaking, movements, and even easy tasks. Fatty acids may also build up in adrenal glands, causing insufficient or no production of hormones that are needed by the body. Normally, VLCFA breaks down and produces fat that makes a part of the myelin, but since it can't be broken down, the fat needed for the myelin can't be made, and myelin becomes abnormal and deterioration occurs. So it's also a genetic disorder caused by a mutation of the ALD gene located on the X chromosome. This ALD gene makes a protein called ALDP protein, which helps LVCFA get into peroxisomes. But since there's a mutation of the ALD gene, the VLCFA can get into peroxisomes and accumulate in the brain and the spinal cord. This disorder is mostly present in males, since males only have one X chromosome. So if there's going to be that mutation, they will get this copy of this gene. Since females have two chromosomes, they may get the disease, but with mild symptoms, or they may not get the disease, since they have that one normal X chromosome, and that could still make the protein. There are three forms of ALD. The first one is a childhood cerebral form. This is a rapidly progressive and fatal disease that occurs between the ages of 4 and 8. And once the symptom occurs, the children usually have 3 to 5 years left of living. About 35% of all ALD patients are diagnosed with this form. The first symptoms that are seen in children is the cognitive and behavior changes, especially in school, since they're in school. Other changes also are visual changes, speech problems, aggressiveness, personality change, seizures, difficulty swallowing, deafness, fatigue, increased pigmentation, and progressive dementia. This form is easily misdiagnosed because doctors think it's an attention deficit disorder, since the kids are hyperactive and there's that change in that behavior. The second type is an adult type, which is called adrenomyeloneuropathy, also known as AMN. AMN patients have spinal cord dysfunction due to the fat that builds up in the spinal cord, causing the myelin to deteriorate. Symptoms usually include stiffness and weakness in the legs, which can eventually cause paralysis of the legs, and people can't walk. The symptoms usually happen after the age of 25. About 40 to 45% of people have this form, and most of them have normal lives. There's also a possibility that individuals could have brain function problems, but that's only less than half of people with this form. The last form of ALD is Addison's disease, which is a rare disease. This type of condition is associated with adrenal insufficiencies of certain hormones such as cortisol. Symptoms can occur at any age and include vomiting, weakness, weight loss, and depression. To treat this, one must take medicine for the rest of their lives to replace the hormones your body can't make. Treatment. Well, ALD cannot be treated, but there's no cure for it, but there's treatment that could help lower the symptoms or slower them. One of them is Lorenzo oil. This lowers the very long fatty acid chains in the blood, but must be used early on as when the child is diagnosed, because later on as the disease progresses, it won't do any good. Bone marrow transplant is also a promising treatment. But it has a harm. There's a 10% to 20% death rate, and also but it does stabilize and improve the symptoms. But downfall is there's not enough of donors that could be suitable to the patient, and gene therapy is being studied, but so far it's only studied on animals to see if potentially they could replace the non-working gene in humans, but that's still a long way to be done. So this is all. This was my project on adrenal leukodystrophy. I hope you learned something.